Yeah, the Department of Health says it regrets an unfortunate error in its media statement issued yesterday about the removal of face mask wearing by learners at schools. It says that this is not part of the gazetted health regulations, and therefore children are also expected to continue to wear face masks in classrooms and general indoor gatherings, unlike outdoors or on playgrounds and sports fields. The error, which was not only in the media statement but also in the Government Gazette, comes as the department announced the extension of the public consultation process together with the introduction of limited health regulations to manage the spread of COVID-19 pandemic and future notifiable medical conditions. The previous restrictions imposed under the national state of disaster expired at midnight. An update then on the COVID situation in the country. South Africa has recorded 6,170 new coronavirus cases. This increases the total number of active cases to 44,808. The Department of Health says that more people have succumbed to the disease in the last 24 to 48-hour reporting cycle, increasing the total number of recording COVID-19 related deaths to 100,407 people. The department says that 27,310 tests were conducted in the last 24 hours. It says the new cases represent a 22.6% positivity rate. Well, wastewater samples in Gauteng, KwaZulu-Natal, the Free State and the Western Cape are showing signs of sustained high levels of coronavirus. The National Wastewater Based Surveillance program screens municipal wastewater for viruses to help inform broader infectious disease control efforts. And to talk to us further on this, we're joined by Jay Bhagwan, who's Executive Manager for Water Waste Use and Waste Management in the Water Research Commission. A very good afternoon to you, Jay. Thanks very much for availing yourself to SABC News this afternoon.
Afternoon, Flo. It's a pleasure to be here.
You're most welcome. I mean, from our last conversations, we spoke about wastewater samples, being used, of course, to detect the levels of coronavirus in particular areas. Talk to us about what you're finding now at the moment, particularly as we're talking about a fifth wave and whether or not we're actually in this fifth wave.
Flo, if you look at, we are amongst the global leaders that had embarked on using wastewater-based surveillance for the COVID-2 virus. We started our program very early, in the beginning of the pandemic. So we've been, growing this database and this information and pattern, over 4 waves. And the third and fourth wave, we were able to indicate from the sampling that we've been doing on a weekly basis at many of the sentinel sites. And when I use the word sentinel, these are the sites that service the hotspot areas that we've identified, through this 2.5 years as the areas that start to show high level of the burden of the disease once it starts spreading. And, the fifth wave, it was last week that we put out a media statement because we could see exactly the same patterns in increase. And we're not looking at clinical samples, we're looking at the RNA copies that are excreted by infected people in the wastewater area that is serviced. And we've seen, a consistent pattern of 200 to 300% increase in the RNA copies. And that was consistent with the previous waves, in terms of how the pattern starts increasing. So we raised the alarm to say we were possibly heading in this direction. And, looking at the daily clinical recordings, we're starting to see an emergence of that pattern.
Yeah, and I want to continue talking about that pattern. I mean, the fact that you're doing the sampling on a weekly basis really puts you at the forefront of really seeing what's actually going on. You mentioned the fact that there are specific hotspots that you had identified. Talk to us about those hotspots and what you're finding as you continue with these tests. I mean, what are the red flags? And do you also find that in these particular areas, and you'll tell us where the hotspots are the hotspots also linked to issues of hygiene? I mean, we know that during coronavirus, we were told to wash our hands more, to sanitize more and so forth. And I wonder, as you pick up on these waste samples, if you're picking up that these are some areas where perhaps there's challenges whether it comes to, clean water challenges. I mean, what are you finding? Because clearly what you're finding has a message of what's going on in those particular hotspots.
So what's unique about the South African experience and case study is that we tackle the more difficult area of non-sewered areas. So, the global experience is a lot from the developing world, where most of the populations, have a flushing toilet and are sewered. So they can give a better indication of what is happening in their communities, because everyone is serviced by a sewer. We live in this inequitable space where a large part of our population lives in non-sewered areas, informal settlements, where they don't have sewage. So we introduced what we call environmental sampling, because we expect that, all the runoff and effluents from settlements, we could pick it up in the nearby streams and use it as an indicator of what is happening in those communities. In terms of the RNAs coming out. We cannot what you would say, justify and confirm the numbers of people that would be infected, but we could raise the alarm of that increase. So, that is also ongoing to the benefit of the non-sewered areas.
Yeah.
In the sewered areas, like I said, it's got to do with sometimes the hygiene aspects, but it's a behavioral issue. Okay, and in the previous waves, we saw big hotspots in Sandton, and Sandton is a well-developed area and was showing the highest increases in infection. So it's not purely just about, the availability of clean water and hygiene, etc. It's got to do with people's behavior that after a long period of living in this kind of COVID bubble, you tend to get frustrated and you feel a little bit comfortable and you feel like taking the risk, and you forget, to practice the basic tenets of what has been sort of conveyed by the Department of Health and many around on disinfecting and mask, etc.
Yeah.
So it's a combination of many factors that are contributing to the spread.
Yeah, I'd like to talk about KZN, and I don't know if you have teams stationed in KZN, and after what's happened there, where we saw the floods, and there was a lot of talk about water infrastructure that had been damaged, and one wonders, and I don't know if I'm using the right terminology here, whether there was any sort of cross contamination, and because we saw what happened. I mean, so much of the infrastructure there that was completely damaged. Is there anything you found there? And if you've not had researchers there, what do you suspect would then be the situation after what we witnessed?
So at present, up to week 16, the sampling in some of the main areas of eThekwini and up the coastline, one or two of the cities and towns there, which were sentinel sites, we haven't picked up the increase in the trend. It's still a little bit flat, but we're expecting something to happen, in the near future. But that's the other, kind of worry is that what is in the wastewater is not an infectious form of the virus. It's a viral particle, which we call, a protein. And it's got a very specific signature that we look for in the wastewater. So it's non-infectious, it's non-transferable, and what people need to understand that the COVID virus is a respiratory virus. It has to be transmitted through the air, through your mouth or through your nose for you to get infected. So it's no big concern in wastewater because it's not in an infectious state. So even with the flooding and the situation in eThekwini, we weren't concerned about the increase of this contamination pathways, etc. We were more concerned around what would happen if wastewater systems failed and let out other contaminants and pathogens into the water environment that could have had consequences on public health.
All right, Mr. Bhagwan, thanks very much once again for giving us your time and your insight here on SABC News. Thank you very much.